This is one of the reasons why I appreciated you early on in the whole pandemic, like asking real questions about the vaccines and so on and so forth. Because as somebody who does have a heart issue and whose dad died at age 45 of a sudden heart attack, I'm very tuned into heart health. And I have 3 kids,
Yes.
including 2 boys. And so I don't appreciate when people try to shame doctors like you out of asking questions, because there are invariably people like me all over the place, millions of us, who would like to also know those answers and don't want people like you who have a public microphone and the education to ask smart questions about these matters from being silenced out of asking them.
Thank you. I agree. I felt like I was running the French underground here. That was trying to just make sense of things and broadcast quietly to the enlightened.
Right.
And it's gotten the same, and it's maybe a little worse right now. I mean, this unfortunate thing that happened with the NFL yesterday, which we'll talk about in a minute, triggered everybody. It triggered everybody. It's very bizarre. And when physicians get together, I was just on a Twitter Spaces where a bunch of doctors were together, and we really only disagreed on one point, and really it was just one point, and it needs to be answered. Should we be concerned about the risk, the all cardiac cause risk to young males from the Moderna vaccine? Should we be worried about that? Yes or no? And if we are worried about it, what is that relative risk of the vaccine versus COVID itself? Just somebody please answer that question. And these, I was talking with one doctor, he said, I think you're going to be very much more at risk from COVID. And I said, you may be right. I actually don't have an opinion. I just want the answer. I don't care who's right, but somebody's going to be right and somebody's going to be wrong. And until we get that answer, we can't know who that is or what we should be doing. Again, we can't even render informed consent to patients. And in California, we risk our license if we bring the whole topic up.
Can I tell you, it's not just the licensure boards, it's the news media too. Like I will tell you that I happen to know that ABC News spiked a big story they were working on young cardiac deaths in relatively young teenagers, like 17, 18-year-olds. They were preparing a report and suddenly it got pulled. Why? Why would you pull a report like that? Like in the wake of COVID, in the wake of vaccines. And I'll bet you dollars to donuts is because it was leading down a road that would have looked like they were questioning the safety of vaccines or heart health in the wake of the pandemic. Either one, they felt uncomfortable and they pulled it, right? So it's like, this happens all the time, right? If you're going anywhere near one of the sacred cows, you better be really effing careful, because you're going to get not just Twitter blowback. Forget that. That's a one-day thing. You're going to get potentially canceled. You could get fired. You could lose your license. Like, it can get absolutely devastating, which is how they're chilling free speech across the board. It's not just the Twitter files and Fauci and the White House coordinating with Twitter to suppress views of Dr. Martin Kulldorff of Harvard on vaccines and so on. It goes way beyond that. And everybody who's paying attention at this point knows it. They either care or they don't care.
Yep, that's exactly right. You mentioned earlier how some of the regulatory officials have changed their tune. I want to read you a tweet. When did this come out? On New Year's Eve or the day of New Year's Eve, I think it was. Yeah, 12:30. From Rochelle Walensky, the director of the CDC. Here's her opening statement. We can't stop the spread of COVID-19. I was like, what? You just shut the world down, insisting that zero COVID safety uber alles was the only option, and you were willing to destroy millions of lives to do it, and now just coyly open a tweet with, we can't stop the spread of COVID-19, which is true. That's true. You can't stop the spread of respiratory virus. Oh, there it is. Let's see, but pre-departure testing, she's talking about China to U.S. testing and this kind of stuff. It's all fine. But we can't stop the spread of COVID-19. That tweet jumped out at me like nothing else. This is a woman, Susan, you're laughing at it. Does this surprise you? You've heard all that they've been saying for the last 3 years, and now all of a sudden, and by the way, we've been saying the same thing, like, hey, these lockdowns, this is a terrible idea. Maybe localized lockdown or quarantining or whatever, but the lockdown thing, you mentioned you had an ex-husband who was a physician. My dad was an old family practitioner, and his voice is in my head all the time. People that watch this stream know it because I brought it up a few times. Just him being confused, going, wait a minute. We had yellow fever and polio and malaria and typhus, and you're shutting down the world for a respiratory. What? How? Wait a minute. Yeah, a respiratory virus. He would have died again. It would have killed him a second time. The CDC states that COVID-19 vaccines are safe, effective, and reduce the risks of COVID-19. Always consult with your personal physician before making any decision about your health.